Okay. And I'm going to go ahead and introduce myself, and then I will kind of pass it along to the panelists to introduce themselves. So, so happy that you all can be here with us. My name is Norma Katie. I am a clinical psychologist licensed in California and Oregon. I use she, her pronouns. I am on the board of Psychologists of Color, Inc., and am also part of the programming committee. So that's where my sort of involvement in a lot of our programs that we put on comes from. And happy to share more maybe at the end if anybody has any questions about Psychologists of Color, Inc. at all. We can talk a little bit more about that. But I'm really happy to be here and to have this panel called So Many Options, Formal Postdoc versus Psych Associate Position, and our great, wonderful panelists who are here to share about their experiences. So I'm going to go ahead and kind of have our panelists introduce themselves one by one, and then we will jump into the questions. And for those of you in the audience, feel free to put any questions in the chat that you have. From my understanding, anything that you put in the chat is just going to come directly to me. So I will kind of filter through questions as we go. And we should have time for questions at the end of the panel as well. So I'm going to go ahead and call on Linda since she's first on my screen. If you want to go ahead and introduce yourself.
Hey everybody, I'm Linda. My pronouns are she, her. I'm currently in San Diego for my postdoc experience, and I graduated from Tennessee State University, currently at 2 informal postdocs at a private practice. And yeah, if there's anything else, I'll pass it on to the next person.
Thanks, Linda. Go ahead, Mahip.
Thank you so much, Norma. My name is Mahip. I use he, him, and him pronouns. And yeah, I also went to Tennessee State University, and I'm currently working at a private practice kind of setting in Central California. And yeah, I originally grew up in India, so that's another important aspect for me. And I was practicing as a lawyer before moving to US to become a psychologist. And yeah, and also mindfulness is my expert area. That's something that I teach my clients, and I also do workshops in that. And so grateful to be here.
Okay. Thank you, Mahip. I will pass it to Michael.
Thank you, Norma, for this opportunity. My name is Michael Oyeteju, born and raised Houston, Texas. I am a graduate of the Tennessee State University with a PhD in counseling psychology. And I'm currently working for the Department of Defense with the United States Navy. So just something to get out the way, the views that I express are my own views only, and do not reflect the official policy or position of the United States Navy, Department of Defense, or the U.S. government. That is all.
Thank you. Go ahead, Aline. Oh, you're muted.
Oops, there you go. Hi, everyone. I am Aline Renaud. I am a postdoc. I've had a couple of postdoc positions at a clinic and a big institution. I have experience in case management, chronic pain management, and of course, ADHD. I'm also originally from Cameroon, and I thought that would be important as someone born from Africa and into psychology. And I'm happy to share my experiences with you all as someone who has done formal and informal postdoc and pre-doc experiences.
Okay, thank you. And Marquis, go ahead.
Hi, yes, can everybody hear me?
Yes.
Okay, and see me okay?
Yes.
Okay, cool, great. I'm so sorry. My name is Marquis Griggs. I am a graduate of Tennessee State University with my PhD in counseling psychology. Currently, I am, I am currently in a psych associate position. So I did not do the postdoc route. However, I did also complete a pre-doctoral internship that was APA accredited with Ohio University at their counseling and psychological services.
Great. Thank you so much. I am so grateful to all of you panelists for being here again and sharing your experiences. So we will jump into the first question. And I am going to also post it in the chat for everyone to see. So this is a question for all of you. And the question is, please share how you decided between a formal postdoc and a psych associate position. What key factors played a role in this determination? Whoever wants to jump in, go ahead.
Well, I'm just gonna go for it. I don't think I was even thinking about the differences, right? I was just looking for opportunities. And this was during COVID, so it was really difficult time. So I was just really wanting anything that whatever was available at the time, which was really difficult. Fortunately, I landed an internship and my supervisor helped me register as a psych associate, as a pre-doc, and work from there, which is something that you all can do as a pre-doc, register now. So it wasn't more so whether I wanted to be formal or informal. It was whatever was available at the time.
I can share my experience. I think so. Another layer of complexity I had was being an international student. So I did go to a formal pre-doc internship at UCSB, University of California, Santa Barbara Counseling Center. So there was, and I have been here on a student visa, which requires me to stay within certain limits. So that's why I was choosing to stay in a university counseling center, or where I have more likelihood of getting, let's say, a sponsorship for a green card, for a work visa. So I was sticking to that route. However, during my internship, I also received a green card. Luckily, fortunately, my wife happens to be a citizen, so I ended up having something else turn out for me. And that was the moment when I got the green card during the internship. I chose, oh my God, I can actually do what I want, So that was a fact. And then it's not like this is better than that, but I knew like this is what worked out for me, because during that internship, I realized I'm working 40 hours and somebody else decides my schedule. Somebody just throws, even though I love the counseling center, I love the people, but you have to be so productive. You have to see 20, 25, maybe 30 people in a week, which is more than what I want to do. So I knew maybe I don't think this is a term, but I have a term called clinical stamina. My clinical stamina is 15, 16 people in a week, and I have no shame about it. I do not go more than that, and I'm very happy right now. So that suffering through that internship program, not because of the work, I love my work, but having to do more than I want. So that was the concern that I had. And I realized that during the internship. And at the moment I got the green card, the moment I saw that there are options out there where I can choose my schedule, where can I design my day, I just got out and I chose to become a psych associate. I found a nice supervisor and found my schedule, and I started doing other things. I can be creative. Right now I work maybe like 15 hours or 20 hours per week. That's it. And then I have other time for teaching, and I have time for doing mindfulness workshops in the community. And I have a family. So that's another factor. My wife was pregnant while the internship was going on. So I had this, I don't think working 40 hours per week, I wouldn't have been a present husband in that way, at least in my case. I'm just sharing my experience. I know some people manage it, and I would not have been so present and so available for my kid. So I think making that choice, and it's literally moving from 40 hours plus all the hard work while processing and taking care of yourself. You hardly have time for these other things like your family and I don't know, other things. So while working only 20 hours such, I was able to make more time for these things, and I'm happy. So I'm benefiting from that choice.
Yeah, thank you.
For me,
Go ahead.
for me, I wanted to do military, so I'm active duty military. And it is a former postdoc, which I've completed. At the time, it was one of the only, if not the only, former postdoc within the military, within DoD, United States Navy. So it's a pipeline. So there's about 3 different ways that you can get to work with active duty. There is through internship, there's a postdoc, which I did, or there's direct ascension. So you already have your PhD, you're already licensed as a psychologist, and then you can come in like that. So I did the middle route, coming in for postdoc. What helped inform my decision was, one, it was a route to get into the military. Also, it's an additional specialized training, having a unique set of skills and opportunities to work with active duty service members. And then also the structure. Being in a former postdoc has afforded me structure and rotation, something that you may or may not get in a non-formal postdoc, because it's, with it being APA accredited, APIC accredited, like it's specific things that need to be done for it to be accredited. So it just gave you that type of structure and exposure. So yeah.
So I can go next. My journey was actually not straightforward as my colleagues here. I was actually ABD for a while. And so in that process, because I had already had a master's degree and working under an associate professional counselor license, and working under that master's degree as well as teaching, I was en route to finishing my dissertation, as well as looking for jobs, psych associate positions, as well as postdocs. So within my experience was that I didn't find a whole lot of postdocs that were still open as I was getting ready for graduation, very few. And so one of the biggest motivators for me was that relocation, also compensation, because for many postdocs, you sacrifice, compensation for the training. And for me, just because, my situation, that wasn't feasible. So for me, it was, all right, I have to go with, what's going to be beneficial, which was the psych associate position.
Yeah, for me, it was, I had done my internship at a UCC too, and I've really valued my time, what I learned there. It was just so structured. It was, 40 plus hours a week. Every hour was like accounted for. And I did not have that stamina either. At least I didn't feel like I did at that time. And I was like, how am I going to do this and study for EPPP and take care of myself? And at that point, I was just so tired too. So I actually didn't even consider an informal until Mahip mentioned he was going to consider it. And it kind of just like opened up that option for me. So I thought about it, and I really wanted to like have more room for fun, flexibility, and just like balancing studying, because I knew I would have to study a lot. And I also didn't like all the staff meetings I had to go to where it really could have been an email. I didn't like all the interpersonal drama. It was all very draining. So this opportunity came up, and I was like, oh, let me see if this could be an option for me. And it was someone that I had met through an organization within APA. It was like Section 5 of Division 35 of like Asian feminists. psychologist, and someone had a position for a postdoc at their private practice. And I was like, oh, to also get to work with a woman of color was important to me too, to have that opportunity, which I know we'll get more into later. But those were the decision-making points.
Great. Yeah. Thank you all for sharing. It sounds like there were a lot of different factors that kind of led you all in the direction that you went in, some of which being kind of convenience or what was available. Michael, it sounds like have had a kind of direct path that you knew that you wanted to follow, and so you found the route to get you there. And then, two of you coming from formal pre-doc internships and knowing that for self-care, for family, for health, for all the various reasons, Linda and Mahip, that you talked about, that having more flexibility and more kind of control over your schedule and things like that was going to be important to you. And Marquis, I think your route, which definitely sounds like you had to. I think the factors that you talked about also were really important in terms of compensation and location. And, I think those are things that hopefully are being considered, by anybody that's going to a postdoc. But at the same time, I think there's also the, realistically, like that, given the number of postdoc opportunities and or psych associateships, sometimes those can't be prioritized, and sometimes there's privilege that doesn't necessitate that priority. So I appreciate the diversity of experiences that you all shared. I know when I had a formal postdoc at University of Southern California, and I still think back to how on earth did I survive in Los Angeles on $40,000 a year? It blows my mind when I think about it. I was very poor, very cheap at the time. So thank you again for sharing and helping, I think, our audience also kind of think about, various routes to consider and factors to consider. So the second question is another question for everybody. If you could go back to before your choice of postdoctoral experience and give yourself one piece of advice, what would it be?
I'll go next. I would say my time was very unfortunate because I was trying to get most of this done during COVID. So there weren't too many opportunities, but like just assume there was no COVID. Really start looking for, during your pre-doc, just start looking for what's out there, trying to network as much as possible. Talk to your advisor, your committees, and all of these things to kind of see what's out there, because it's really difficult to find a positions like we talk about, making a living, a lot of these things you're doing it full time and you probably have bills to pay. So that's an important factor of that. And also trying to figure out whether you want to go in private or public or combination, really what's important to you, what demographic you want to work, So all of these things are really important. Don't wait till the last minute to figure this out. Just really start having this conversation sooner.
I can share. I think this question takes me to a couple of perspectives. One is like, I think it's, even though I was clear that I'm leaving the formal setting, no longer working for an organization, I'll find a supervisor and I'll work for them. One thing that one advice that I would give my past self is like, really look into the background of the supervisor. Even though I found a supervisor who looked great on paper, like a good personality in public, things did not turn out to the way. They were not competent. They didn't understand my background and how to work with a person of color, for example. And there were things that they were not doing professionally. And it just was very hard for me at the beginning. I was very proactive, and within few months, I just ended up letting them know. And I just swapped my supervisor. I contacted the board of California. I found a different supervisor. This time I knew the supervisor better and I did my homework. So it's just like when you apply to an organization, they do your background check. And so I think we are also interviewing them. So I think I didn't do much. I was kind of stressed. My wife was pregnant, so I was just like rushing into it. And then I think I was so exhausted from the internship interviews, like having like tens of interviews back to back. And it was so exhausting process to apply and documents and paperwork, essays. So I was really happy when someone just met me and offered me a job. And like, wow, that was so easy. But then it didn't go well. So I learned from my experience, and I found somebody who was not, and another element of it is like, even though they might be a good human being, they might be maybe a good clinician, they need to know how to be a good businessman. It's a business. So if they don't know how to negotiate with insurance companies, they don't know how to do the billing, if they don't know how to like manage their time, you're going to get stressed out, or things might fall onto you. So of course, there's a big reward when it comes to time and money and flexibility when you're moving into private practice. There's a bigger risk involved also. So this is something that I learned from my experience in the last couple of years. Another element is, because I grew up in India, I didn't know the system here, the insurance companies and how they decide your rate. So I was shocked. I was just in this fantasy world. Okay, I will choose this rate and I'll do the math. I'm going to make this amount of money. But I had no idea. I don't get to choose my rate. Insurance companies do. So it's like completely threw my math out of the window, and I was poor at the beginning. So these are a few things that I learned later. So learn the business aspect of, talk to people who are new in the field, who are also like who know the business piece of it, especially when you're moving into private practice. If you're going to be a psych associate, understand how these insurance companies work, especially if you're taking that route. So the more information you have, the more power, the more knowledge you have, the more in control, the more better decisions you can make in these small things. And yeah, and also, and one more advice I would say, like, start working on building a brand, because the stronger brand you have, like if you are an expert in a certain field, it looks good for insurance companies. You can negotiate a higher rate. This is something that people don't talk about. Insurance companies discourage you from telling your rate to other people. However, some people get more out of insurance companies, some people get less, because some people are seen as experts and some people are just a regular clinician, a generalist. So another advice, if you're taking this private practice route, make sure that you are focusing on expert area, put that out there, get more trainings in that area. And I'll pause here. I can go on and on.
So much wisdom. Thank you.
So for me, being that I'm actually in the psych associate role, if I were to give myself a piece of advice before choosing the route that I've taken, I would have, well, for one, I would have given myself, advice well before in the dissertation phase, get it done sooner. However, I definitely would have advised myself to reach out and connect with my program coordinator a little bit more. And so she has a wealth of knowledge, and I own my shortcomings on, myself, that, the program is there, and the program coordinator, along with, my committee, has a wealth of knowledge that, and they shared that with me, and just like, okay, why didn't I do that sooner? And so about resources and places to look towards for additional training in different areas that I wasn't really aware of, and how to negotiate. And so that would be one of the biggest pieces that I would have recommended to myself and others, is that regardless of if you're on track to graduate, if you're ABD, and you have been ABD for a while, to stay in contact with your program and your coordinator and your faculty, because there's a wealth of experience and knowledge there, and they can get you connected to a lot of different individuals.
For me, so to clarify, I work at 2 places during my postdoc. So one place I started was self-pay only. And then I had to pick up another place that takes insurance and like Medicaid, Medicare, because I couldn't build my caseload fast enough. So my advice to myself would be to really talk to people in terms of being not just private practice, but postdocs in private practice, and how realistic it is to build a caseload of just self-pay clients. And it was a struggle and continues to be a struggle, which is why I had to seek out another postdoc experience to get the hours and to pay my bills. And then another piece of advice would be to negotiate the rates. I was so hungry at that time that it was just like, okay. And I had some knowledge of like what my friend was making at a master's level, what a previous postdoc was making. So I didn't even try. And I feel like I should have, not nearly knowing if it would go anywhere, but I should have. And so that would be the 2 big pieces of advice I'd give myself. Like, how realistic is it to build a caseload with self-pay? Do you have enough resources to maintain? And also negotiate your rate.
The only thing I would add to everybody who has spoken, one thing I wish I would have done more of was plan for the EPPP, whether that's saving, studying, thinking about the new part 2 that everybody's gonna have to start taking soon. So just planning for the EPPP more proactively, and because we all have to take it. Well, you don't have to, but if you want to be a psychologist. And then the other piece is thinking about where you want to work next, or what you want to do next in regards to a postdoc, and seeing if your internship will allow you to cater your internship experience to that postdoc. So getting some additional, for me, it would have been very beneficial to get additional training in like severe clinical psychopathology. So if I could have gone to my internship like, hey, are there any opportunities to get some more reps with diagnosing severe clinical psychopathology? That would have really helped me now today. So just being able to see if you can cater your internship a little bit more to what you want to do next. That's all.
Yeah, thank you all so much. That's a lot of really valuable advice. I think that one thing I heard Marquis say was like, basically use your support systems, like the folks that are there, whose job it is to help, and not just because it's their job, but because they hopefully and typically do care about the students that they're working with, and that they are full of knowledge and resources and support to provide to you during those experiences. And also, I was feeling some themes of like how to be more intentional with kind of thinking through and thinking proactively about the experience that you want, the type of supervision that you might end up having, issues related to pay and caseload size and all those pieces. So really, I think it can be easy to kind of get swept up in the timeline, and from pre-doc to postdoc, and wanting to hurry up and kind of get the requirements done to get licensed. But where possible, and for the value of the experience, to be able to kind of take a step back and look more broadly at all those details that really are important. Aline, it looked like you wanted to add something.
Yeah, I was just going to add that to more to the pay and the supervisor part, where your supervisor is very critical in helping shape your your clinical development. So be assertive, right? Just don't go with the flow. Sometimes when you're new, you don't really know what to expect, and you just go along with things. If it doesn't feel right, voice, be a little bit more assertive, speak on it. Because I've been there, and sometimes we feel a little bit like in my case where I felt like, oh, just suck it up a little more, and it's really, think about that. This is your opportunity to learn and grow and develop new skills and build those skills. So don't suck it up for anyone because you're trying to be a team player. This is an investment, right? That low pay, it's because of what you're getting out of it, right? They may not be paying much because they are training you. So you have to get something out of it.
Mm-hmm.
And in terms of pay, look at in your area, right? In my pre-doc, I was only getting paid because it's required by law, and I was not making any money. And then in my postdoc, that was a factor, you have to pay bills. And then you have to look at that. And again, I want to stress the importance of your supervisor. You need a competent supervisor. Some supervisors out there are just new, so they really don't know what they're doing. Sometimes if you are in a psych associate positions, it really is a job, not a training position. So you really need to understand the differences that some psych associate positions, they just throw you out there to work, not to build skills and train you. So you need to be assertive and demand that 4 hours of, supervision, So you need to know what the recommendation is, what the expectation is. So if your supervisor is not meeting those expectations, you can bring that up, right? And of course, pay is very important. Look around in your area, how much other places are paying. I left the positions and I was making significantly way higher when I switched positions. And that was really wonderful to get a paycheck. Okay, it's really nice.
Mm-hmm. Definitely. And I appreciate you kind of emphasizing the importance of a strong supervisor and considering the pay. And I really liked what Mahip said as well, related that, in looking for a postdoc experience, you should be interviewing them just as much as they're interviewing you. And I think that is just invaluable to stay aware of, because this is, ultimately this is the final year of your kind of training experience before you're on your own as a, clinical psychologist or a counseling psychologist. And so it's an important year to kind of get the experience that you want. And so being, again, I think really intentional about those nuances. Since we were talking about pay, I want to throw in a part of a question that came in the chat. That was, what is the pay difference between postdoc, formal, and a psych associateship? I'm not sure if anyone wants to kind of share thoughts about that. I think it's a hard question to fully answer because I think every experience can pay, quite differently. Even, my postdoc experience at a university was fairly low pay, but a different formal postdoc, maybe in a forensic setting or in different settings could pay more. And then there might, I think there's also variation in psych associate positions. Linda, you want to add something?
Yeah. Oh, so I'm not sure what the difference is because I forgot how much the formal ones cost or formal ones pay. But just between my two postdocs, the pay structure is so different. I have a rate right at the self-pay, it's 140, but the split is 60-40%. Where I've heard at other practices, it could be 50-50 or 40-60 the other way around. At my other practice that takes insurance, it's just a flat rate per session, and that's what you get. So that's how these are structured for me, but I feel like other places might be structured differently. And then so it just kind of depends on how many clients you take and from where. So yeah.
Definitely.
I'll talk about pay that I've experienced. Just a little bit of a recruiting piece. So active duty military internship, they can make starting off anywhere from 50 to 80. And then even with postdoc, about 60 to 100. So just thinking about your opportunities. If pay is a motivator, which as you continue, as I've been studying EPPP, it can be, but not really. In the military, you can make a significant amount of money your first year internship, postdoc, up to 6 figures, depending on the state that you're working in.
I'll add,
Thank you.
I'll add a little bit. So I think I just did a quick math. If you're seeing 25 clients per week, and if you are getting, let's say, $65 per session, which I got from, if you're getting 55% and your supervisor is getting 45%, I know it's a lot of numbers, then you can get up to, in 12 months, you can get more than 75,000. And or like almost close to 80,000. And this is like 25 sessions per week. And if you stick to that all year round. And I know that if I would have continued a postdoc, a formal postdoc at the University Counseling Center, where I would have to work 40 hours per week, it was 52,000. So, or now maybe with maybe some little bit increments, it might be 54,000. So, but as I was leaving, I did the math, which was actually originally wrong, but now I have the accurate math, even with working maximum 30 hours, including paperwork and everything, I can get to 75,000. However, I have to work 40 hours per week at a formal postdoc in same city, same town. I'll make 55 maximum. So that's what motivated me. However, benefits, you have to find your ways, you have to get your own health insurance and everything. So that there is something there. So, but these are some numbers I just calculated.
Yeah.
Thank you.
Like in my case, I was salaried for my first postdoc, and that was in the 70Ks, and that is like a 40 hours. It includes all the benefits, insurance and all of that stuff. And of course, I was seeing about maybe 20 to 24 patients a week, right? Because there's clinical hours and supervision and all of that. So I don't have to worry about the individual, how much I'm getting per hour, because it's all inclusive. But when I switched, there was a significant jump in my salary, about 40K, and it also includes all the benefits, PTO, insurance, holidays, all of that. So those are the things that you need to think about. Now I feel comfortable as a postdoc, psych associate, with how much I'm making in comparison to how much other organizations pay. I also want to stress that I'm in the Bay Area, so they may also be, that factor. So it really depends on who you're working for. If you are in a private practice by one person private practice, they may be paying you per session. So if all of your patients cancel that day, you're not making any money, So those are also things to consider, where they only pay you based on the number of sessions you've had that week, not how many you had scheduled, and no benefit. So those are sort of things to think about, what you're looking for. Yeah.
Thank you. Hopefully that provides a little bit of insight for folks in the audience just about kind of the variety of pay options, kind of depending on experience. Okay, we're going to jump to the next question. And this is again for everybody. How, if at all, did being a person of color influence your decision about the type of postdoc experience you sought out? How has being a person of color showed up for you in your postdoc experience?
So for me, being that I took the psych associate route, for me, just I think looking at just the mission of because I'm currently at a university counseling center, and I think for me it was the mission of the center, just what their values and diversity are, because I've been several places, PWIs, HBCUs, and they are not the same. And so, their values on diversity, in regards to racial diversity, diversity of sexual orientation, religion, so on and so forth, how do they value their students? How do they value the diversity of the individuals that work there? And so I've been fortunate to see with Auburn SCPS that wealth of diversity amongst the staff, who are people of color, but also non-people of color, but also having a passion for working with a diverse group of students, and their areas range from sexual abuse to sexual orientation and social justice, with students of different gender identities, sexual orientations, and race, ethnicity. And so, that's kind of getting in there and interviewing them and just seeing, behind the scenes, and not just that diversity statement for APA.
I can quickly jump in. I feel I was more intentional while choosing my internship site because I had several options, and I chose the school based on how many international students were there. And it was in California. I moved from Nashville to California, so I was like already wanting to be closer to my family, which is in California, and more diversity. However, while moving from my internship site to the postdoc, which is a private practice, I didn't think much about this piece. I knew that this is what I want to do. I want flexibility. So there were other factors. But I can answer the second piece of this question, like how is it showing up? So now I'm like surprised. Like I was just reflecting 2 weeks ago in my group supervision with a couple of colleagues. Like I have 14 people on my caseload and at the moment, and 12 of them are person of color. More than half of them are like immigrants. So it's not like I'm doing anything. It's literally, I have a profile on psychology today, and this is who comes to me. I have only 2 white people, and mostly like 12 people are person of color. So it's not like I'm advertising or trying to do it. It's just happening this way. So it's showing up in a very interesting format, and I'm enjoying it. And I have a big immigrant population, international students. So this is how it's showing up. I'm pretty happy that I don't have to control, or I don't have to tell the staff members to send me these people or not send me these people. It's happening organically. Yeah. Thank you for the question.
For me, as I mentioned at the beginning, in terms of a supervisor, I was really looking for someone that I wouldn't have to make them feel comfortable when I'm talking about intersectionality, race, gender, power. And so my supervisor at the South Bay, She really fit the profile. And I also saw the people she was bringing in. So she's an Asian woman, Filipina, and that's like her clientele was a lot of Asian folks, which is cool. So I was very intentional in terms of supervision. And then as I'm seeing, I did struggle like, oh, like private practice, like I'm just serving people who are like super privileged, don't have all the resources. I was really struggling with that. Probably serving a lot of white people, was my assumption, very rich white people. And then all my clients here at this practice, they're literally all people of color. And some of them are like Vietnamese American, as I am too. And I've literally had only worked with one Vietnamese American person my entire career up to this point, because I did my internship and practicum in the South. So that was interesting. And it was interesting for me to like deal with the countertransference too, and like the stuff that comes up. So, but I think it's really cool. Like I have parents seeking me out because they want me to, counselor their kid, and because we have that shared background, and it's kind of neat. It feels really weird, but in a very positive way that I wasn't even anticipating, because I didn't think it would be a thing, but it happens very naturally. So.
Well, my experience is a little different. I started my pre-doc in work comp, chronic pain, pain management. I didn't even know that I could do such a thing as a psychologist, right? So this was just like folks getting injured at work. Either it was a physical injury or a psychic injury, and then there's like psychological issues associated with those injuries. And for the most part, it was either Black folks or Latino, those kind of blue-collar jobs. So by default, even though my supervisor was a white man, it was a one-person private practice with 3 psych assistant. So it was just kind of felt that way. But as I move on to my postdoc and I continue in that realm of work comp, chronic pain, but it was a much bigger clinic at this point, right? And I found myself getting a little more of African-American patients, even though it was still about the same, like Hispanic, Latino, and African-American, and some Asian. But I started noticing that I was being giving a little bit more of the African-American patients. And this is a little bit more interesting because I don't identify as an African-American being born in Africa. So my dissertation was actually in understanding more the nuances that African-American face as a person of, when you look at me, I'm Black, So the assumption is I understand as a person of color. So my dissertation was to focus on African-American experiences in seeking mental health and retention, because at some point I was thinking to myself, I don't want to disappoint. Folks are going to come to me because they think they can relate just based on the way that I look. But then again, we don't have shared experiences. So I really went out of my way in my dissertation interviewing African-American therapists and the experiences and what the patients are coming for, and also as an African-American therapist, psychologist, what the experiences is, just to help myself so I can, better represent, I suppose, or at least have an understanding of the nuances that African-American face. And particularly during 2020, with, we all know what happened, and then COVID and all this Black Lives Matter, and I was really motivated by that. So I could definitely tell, where I would be sending like a African-American patient. And I was like, well, let me talk about cultural humility. What does my research say? Because I did qualitative research where I conducted my own research and wanting to have a better understanding on how I can better represent.
I will say I'm often referred to as a unicorn, which I'm still not quite sure how to interpret that. But my colleagues, since I've been in the military, that's how they refer to me as. There's not a lot of Black males doing what I'm doing in the military. I've actually only come across one so far. There's at least 400 of us. I know there's more, but I've only come across one. Plenty of Black females, which is awesome. How it showed up so I wanted to be in the military my big thing is destigmatization. So being a Black male mental health provider, just wanted to continue to destigmatize mental health for Black individuals, especially those individuals that are in the military, because it's still something that is taboo, even in the military, with more stigma, fear of potentially losing your career if you're coming into mental health. So it's coming in to let people know that you can talk about these things and still stay in the military. The other thing is how it showed up for me. So with me being a unicorn, me being a unicorn, let people know that, unicorns do exist. You can find one. There was a young male. He actually wasn't even active duty. He was the son of an active duty service member, because we also see kids. So I'm at the intersection of Nigerian and American. So just my ethnicity. He was a 17-year-old Nigerian male, born in America, and had Nigerian parents, very Nigerian parents, just like myself. And from maybe middle school to high school, he's worked with white, older females and males in the hospital. And he told his white provider, "You're great, but I really would like to work with somebody that looks like me." And he listed off this criteria that he had, like a checklist: Black, male, middle age, Nigerian if possible, boom, 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 boom. And this provider, who was my coworker, he was like, I think I may know somebody that fits that criteria. So like to the T of what this young man wanted, not just throwing stuff out there, not necessarily knowing that it would exist, but threw it out there, and I was actually able to check out those boxes, and it was actually a good fit, not just because of how I looked, but definitely did help get in the door. But that's how it showed up with me specifically. Like, even if it's just that one person I was able to help, I feel like that was beneficial. The reason why me being in the military, it was in that moment, it was gratifying for me.
Thank you all. Gosh, it's really interesting just to hear about sort of the different experiences you all have had, and how your own identities have kind of impacted different opportunities that you have sought out or not, and how they have shown up in the spaces that you're in, even in unexpected ways. Because I'm really struck by, it sounds like all of you have, had the opportunity to work with a significant number of people of color, and that being people of color in the spaces that you're in has kind of caused other people of color to kind of gravitate to you for support. And it sounds like, in Aline, in your case, that you were actually being assigned African-American clients because of maybe an assumption that you would relate, because of identifying as Black. And I'm assuming that a lot of people of color in the spaces they're in, I think, have similar experiences, as far as, especially if you are one of few, at your location. And so I think it's a something that I think people of color, we know is going to be part of the experience, that our identities are going to come through, whether we expect it to or not. But that it sounds like there's also some variability in how your own identities impacted what you were looking for in an experience. Aline, go ahead.
Yes, and I just wanted to point the reason that I brought up my dissertation studying African Americans was important, because my whole committee was all white. And I actually had to really fight for my dissertation to the point where I had to get outside help from African American psychologists, to support me with my dissertation to why it was important and highlight the importance of what I was doing, because race is still very uncomfortable for people to discuss, especially for white folks. It is really difficult to talk about these nuances. They tend to be very uncomfortable with those conversations. So having like an all committee that was all Black, all white, and here I am with my dissertation and they pushing back because maybe they felt uncomfortable, to the point that I had to get folks involved in making sure that this is what I want to do and it is okay. And so I had to fight for that.
Yeah. Yeah. And I appreciate you bringing that up. I feel like we could have another panel on dissertation experiences. I actually had a similar experience because my background is Arab or Middle Eastern. I'm Lebanese. And my dissertation was related to second generation Arab Americans. And no Middle Eastern or Arab faculty at my, where I went to grad school. And so I had to find kind of folks across the country to consult with. So it's, I think there are different kind of obstacles that, as a person of color, depending on what your focus is on and where you're located and, different things like that, that we're facing at all levels of, the journey or path to becoming a psychologist. So I appreciate you mentioning that. Okay, the next question. I have this for Aline and Linda, just to get some female perspectives on this question. Did your graduate programs guide or recommend any particular direction for postdoc? What information was shared in your programs that was helpful in your determination?
I'll go first. I'll make mine quick. I don't believe I received any guidance, or at least I don't remember.
I didn't receive any. It is funny. I feel like everything that I have done so far, it was really me just throwing myself out there and figuring all this thing on my own. And that was really has been my journey. And really that was the reason I decided to do this, if this can help somebody else. Because I really didn't know what I was doing. I was just really trying to figure everything on my own. So I'm really thankful for this platform to, help other people out there. Hopefully you don't have to struggle as much as I did.
Yeah. I appreciate both of your honesty about that. And I'm curious, I guess, just with your responses, anybody else on the panel, did you have any different experience where there was more kind of talked about in your programs or directly to you, or did you have to seek that out on your own?
I was laughing because I went to the same program as Linda. So that's the laughter.
Sure.
So I'm laughing in agreement and also discomfort. Both are present.
Yep.
Yeah, no formal conversation. If we did, it would be again with my peers, Mahip and Linda, and maybe a cohort or two cohorts above us, but nothing formal. But I will also say I don't recall asking my program. So I will also say I did not ask my program.
Okay, yeah, thank you. I think this question also just makes me wonder, I think we had talked a little bit about the intentionality behind the process and how that might be different for white students going through their programs. If there is, whether it's through mentorship where those conversations might happen differently, or if there is, maybe a different level of knowledge or different, I think about just other areas of privilege that might allow for the time, the space, the energy to kind of seek out those conversations. that's just a question that's kind of coming up in my mind right now as just hearing your responses. So thank you.
I'll just add real quick as you say that, I think about like I know how like tapped out they were. Like during that time, it was like pandemic as well, not to make excuses, but and also, you know, all our internships were out of state. I feel like we're also kind of out of sight, out of mind, unless we're like, hey, come help, maybe. I think that was also a factor.
And I want to add, I think there was a private practice class. I didn't take it, but I think some of my classmates, so the class where they teach you how to have a private practice. Maybe it showed up in that. It was an elective, so not sure. But I didn't, of course, like Michael, I never asked, so it's on me too.
Yes, and I just want to follow up with that. Practicum in my university was an elective, right? So I was thinking about I can either take more classes in cognitive behavior therapy versus paying for a practicum because you still have to pay for it. And then you have to do a series of practicum if you go that route versus I can get an internship on my own outside of that and not having to pay the university for that. So that was also like another route, but I didn't get any help in terms of finding placement or any of that stuff. It was just you on your own. Even with the practicum, you still had to find it. So it was just more so, why should I even pay you for that?
Yeah. Go ahead, Michael.
Well, I was going to say point of clarification because I don't want to be called out. There was at least one professor that would send out emails about postdocs, and she would do that. She would do that frequently. There was one professor from our school that would send out postdocs through a listserv. Okay.
Thank you for sharing. And it sounds like there's, definitely some, I think, variation in the level of support based on the school that you went to. Aline, I am so sorry to hear that even for practicums that you had to seek those out on your own because, I think that's something I really appreciated about my program was that the school already had relationships with, probably 100 different sites around the state. So they were really proactive in helping students kind of get, practicum locations. So definitely some variation there, it sounds like. And I have a message from Christy in the audience who said, after graduation, you're on your own. That sounds like she also did not have any support with postdocs. So thank you for sharing. This next question is for Mahip and Linda. Oh, did I get that in there? There we go. So you both completed or are completing psych associate positions to earn your postdoc hours in private practice. Tell us what you would describe to be the pros and cons of doing so and key considerations. I know we've already talked about some of these things, but if there's anything additional that you want to add.
I can start, and maybe if more things come to mind, I'll add more. But I think pros, I think I already said, like the flexibility and the control that I have on my life. And also this interesting thing that sometimes I can meet with a client, and if I don't feel like this is a good fit, I can say no. But that maybe that existed in an organization, but I don't think it's so easy. So it's like interesting things. Of course, it doesn't happen much, but and then one big difficulty or challenge that I had was like, of course, building the caseload, especially if you are taking private pay. If you do not accept insurance, or for example, if your supervisor is not paneled with insurance companies, especially a couple of them, which is important names like Anthem and Aetna are these insurance companies, at least in California, I don't know about other states, who allow psych associates to actually see clients. So, but other insurance companies don't allow that. They don't have that option. So if your supervisor is paneled with these two, then you can get a lot of clients who have these insurance and see them and fill up your caseload within no time. So my caseload was full so quickly. because I have worked at the university and all students had Anthem. So I learned like, okay, networking is big positive. I am very good at networking, and that really like helps me like build a caseload fast. And another piece was having panel with insurance companies, especially your supervisor. And it's still a challenge. I worry about the time when I'm moving out of this and I'm building my own. It will be a long gap maybe to get panel with insurance companies. There will be a gap of a couple of months. I might lose all my clients if they don't pay me out of pocket. So there are these other random anxieties. And yeah, and also the benefits. Like I'm not like, it's just like a business. Also, if I go on vacation, I was in India for like 4 weeks and I made zero money because I'm not seeing anyone. But if I'm at a postdoc, formal postdoc, I have vacation time and all those benefits and health insurance and such. So there are so many like, yeah, variables to be considered. But I don't know why. I just prefer this freedom and flexibility, and I can make my own business. And I can get creative. I didn't mention earlier, I'm an adjunct professor at a local university. So I do teach a couple of classes and make some extra money, and I get to like really enjoy that part of my identity. Like I don't want to just be a clinician. I also want to be a professor, and I can do both because I have so much time. And it's really hard if I'm like working for 40 hours plus at an organization. So there are many reasons. For me, it's working out great, and especially if I have a partner who has a job, so she gets benefits, I get benefits. So that gives me that there's a privileged position there for me. So there are so many decisions that one has to make, but these are few things that come to my mind when I think of pros and cons. Yeah.
I'll piggyback on that. A lot of things to consider if you have enough savings, how long it'll take for you to build your caseload. I'm lucky in that I was so poor and I live in California, I get Medi-Cal, right? Because my income was zero for the longest time. And I don't like to think about that time. But yeah, I wouldn't have health insurance. I'm not married. I don't have a formal postdoc. So if anything actually happened, I'd be in real trouble medically. So those are some things to think about. Time to study for EPPP. That's some of the pros. I love not going to any staff meetings. There's no drama that I'm aware of. Because that's so draining. I really get to see the type of clients that I want to see at the self-pay practice, at the practice that takes insurance, including TRICARE, which is the military folks have. I was able to see that, like, oh, I enjoy working with people who are in the military. I enjoy people transitioning out of the military. I see Medicare clients. So I'm like, oh, I love working with older adults and end-of-life issues, where I probably wouldn't have been exposed to that at the self-pay practice. So I got so much exposure to all these populations that I never even considered. And now it's like, oh, I really enjoy this work in this population. So that was really great. I feel like I was able to get a really full picture and develop my interest in areas of focus. But the money part is very, very stressful. Very stressful. Yeah, you don't get I never know what my paycheck is going to look like literally every month. I don't know because I get no shows or cancellations, and it's like there's no consistency, and that's kind of very anxiety provoking for me.
Yeah, so there's some unpredictability, I think, that you're both hitting on kind of when you're doing private practice. There was one question that came in about an informal postdoc or informal psych associateship. And Linda, you had kind of mentioned, I think answered this for yourself earlier, but it was, how did you go about finding the informal postdoc position? I know, Linda, you had mentioned basically like through networking with, somebody that you had known through an APA division. Anything else you both want to add about that?
I think I'd also talked to other people in the field and they're like, oh, I know someone who has postdocs. Let me give you their contact number. And I emailed them. Or I had a friend who was like, oh, I work here now and I know they take trainees. So just talking to people and seeing who's hiring.
Thank you.
Yeah, and I'll just add quickly, like, same networking in the community and also these emails. Plus, at the counseling center where I did my internship, there were 35, 40 psychologists. And some of them already had a private practice, plus they had this job and a private practice on the side. And there was a big rotation, especially after the pandemic. And then my current supervisor, who's amazing, I met him at the counseling center. So he moved out and then moved completely out of the counseling center and has his own private practice. And then I knew him. So I just reached out to him. And then also through when you go to social events and stuff, you meet people. And then for example, there's a local Santa Barbara Association of Psychologists, for example. If I'm on the email list, they keep posting, oh, this workshop is happening, this event is happening, this coffee hour is happening. And then, someone is they have this open office if you want to rent, or someone is looking for psych associates. So they keep posting every day, every day or so. So once you're in the network, you will find someone and you just keep asking.
Thank you. Aline, did you want to add something?
Yes, and I just wanted to add to that, like I have also worked in private practice with like where my supervisor, he was the sole owner of the practice. I found a position on Indeed. So you can find private and or big organizations through Indeed as well. Just book like registered psychological associate or psychological assistant, whatever, and just put your filters. Also just I would sign up for your local psychology associations. I mean, the Bay Area, I'm on the San Francisco Psychology Associations, all of those things. And there they also have programs like for graduate students where you can seek for mentorships and you can just let them know what you're looking for. And if anyone most of these folks are in private practice. So you can just sign up as either a student or postdoc and let them know what you need. So what you're looking for to the whole server and it will go out.
Great. Thank you. And I want to bring our attention to the time. We have about 8 minutes left. So I'm going to try to get through our next 2 questions related to pros and cons. And then if we have some time left to answer some of the questions that have come through the chat. So this question is for Marquis. So you did a formal pre-doc internship at a UCC, then went into a senior staff psychologist position as a psych assistantship or associateship. Tell us what you would describe to be the pros and cons of this route and any key considerations.
So there are some states that require that you have a formal postdoc. I know here in the state of Alabama, you are not required to have any postdoc hours or supervision. You can take the ECCC and their jurisprudence after your degree is conferred, and you can be licensed. And so that may even cause some trouble down the line with certain states where you are required to have postdoc supervision and hours. And so Georgia is actually home for me. So one of the things that I was fortunate to be able to do was negotiate, me receiving supervision. And so luckily enough, student council and psychological services here at Auburn University, they're on top of it, and they're just like, oh, okay, yeah, not everybody's staying here in Alabama, that some people have to go to other states due to, spouse or their home state and so on and so forth. So, they were very cognizant of that. I was able to talk about, just like who would probably be a good fit for a supervisor, as well as, just a few other issues. I think with the staff psychologist position with the postdoc versus the postdoc, of course, compensation. So in my, in the few interviews that I did have for postdocs, they were, university counseling centers. One was with a hospital. And so it varies amongst these sites with compensation, whereas the hospital was actually compensating more. However, in my position, that actually being compensated at a higher rate. And so, that helps. However, one of the cons, many cons of taking a senior staff position is that you're coming in as a senior staff member because you now have that degree, you have those letters behind your name, and so you are quote unquote trained as a journalist. And so whereas in your internship or even a formal postdoc, you may have these specific rotations. And so here, the opportunity for shadowing certain clinicians where they have a specialty area may be few and far between. And so, getting that license, and then fortunately enough, SCPS tries their best to open up opportunities to send clinicians for conferences and trainings. So that kind of offsets, the inability for training within or rotations within SCPS itself. However, they are committed to, the skills and building those additional new skills and just a lot of different other stuff with their clinicians. So, I mean, it kind of balances itself out in a way. However, if you are looking for specific trainings, for example, where I am right now, doesn't because there is also a clinical psychology clinic as of right now. SCPS does not offer any rotations in psychological assessment. And so if you're really wanting that, if you didn't get it in your practicum training or in your internship training, that it would be beneficial to, if that's an experience that you really want, to really consider a formal postdoc to get that specialized training.
Thank you. I appreciate you also bringing up a couple things that haven't really come up yet, as far as like professional development opportunities that might come up, in a postdoc experience. We've talked about compensation, but also, the opportunity to look for specific, training experiences or areas of expertise that you're interested in. And so thank you for that. And I'm going to speed us through this last question for Michael and Aline.
Real quick, I'll start off with the cons. Still in the training status, which for me is like, I was speaking to Linda's point earlier about being tired. Like, I'm tired of being in the training status. I am tired of it. And then the other thing is scrutiny. Your notes are going to get scrutinized. I have 5 different supervisors, so having to adjust to different writing styles every time I switch supervisors. So those are the cons. Pros, wealth of support, wealth of knowledge, wealth of resources, stable pay, great benefits, opportunity for specialty training, like Marquis mentioned, protected time, so you can have time carved out for specifically for studying, and feedback and supervision. So guaranteed feedback, guaranteed supervision from experts in the field. So,
Yes, and I really want to second that too. It's formal, it's structured, you know what you're getting for, you don't have to worry about your hours. You have your 4 hours guaranteed to supervise. So everything is so structured, right? In my case, I'm doing evaluations, I'm doing intake, I'm doing psychotherapy one-on-one, I'm, running groups. I'm getting exposure to, DBT, ACT, you name it. I'm doing ADHD coaching. I'm just doing a little bit of everything and trying to figure out what I really like. And there's a great opportunity here, right? And you're surrounded by a bunch of smart people, especially if you're interested in like evaluations, and it can be very time consuming, especially for me, since I do mostly ADHD evaluations, and those take a long time because there's collateral contact, there's so many batteries that we use, and you're just trying to like rule out so many other diagnoses, differential diagnosis. So that part is very helpful because you really get to learn a lot about diagnosis and symptoms, and that's really the best way to really get to diagnose and understand the symptoms and what's what. And the pay is
Great. Thank you so much. And I really want to respect everyone's time. And that we have hit 7:01 Pacific time. I know some of you are all over, so you're even later where you are. But thank you all panelists so much for being here. There were some additional questions that came through the chat. I don't know if anybody is willing to hang around and just kind of chat with some of the audience members. That would be wonderful. But before anyone heads out, I do want to just put in the chat the link to psychologistofcolor.com. We had in the audience, it looks like she left, but Dr. Monique Turner, who's the president of Psychologists of Color, was here. But please check out some of our other kind of programs and events. We have a mentor program. So for those of you who are either early careers, doing your postdoc right now, internship, or students, you can sign up for the mentorship program and get matched with other psychologists of color that are interested in mentoring. We have an EPPP coaching circle regularly that meets, and so you can join that. And then we have a schedule of other workshops and panels similar to this throughout the rest of the year. So please keep your eye on the website.